The facial nerve then enters or exits the skull via the stylomastoid foramen, enters the parotid gland, and branches into its terminal branches, supplying the muscles for facial expression. Okay, it exits here, stylomastoid foramen, enters the parotid gland. Now, just a quick application, say if a patient has a parotid gland malignancy and there is a perineural spread, which special function will be affected first? You see here, parotid, this is the parotid gland. So this is the extra cranial segment. The first special function to be affected would be this one in yellow. And this is the chorda tympani, which stays in the anterior two-thirds of the tongue. Now, what if we have a patient with peripheral facial nerve palsy, but without problems with special functions of the facial nerve? We can then check pathology for extracranial uh, nerve 7 or the parotid segment. Lastly, I would like to talk about facial nerve enhancement. So the facial nerve is the only cranial nerve which may enhance. But which part of the facial nerve? The intratemporal facial nerve has a normal, lush, vascular plexus that supplies the facial nerve. So, hence a normal enhancement of the intratemporal facial nerve is normal except for the labyrinthine segment, which is the least vascularized portion. So, if we drew uh, an area which would represent the areas which can normally enhance, it should cover this area. From the anterior genu, tympanic, posterior genu. Again, the labyrinthine segment is the least vascularized portion, so it does not enhance. On the other hand, facial nerve enhancement within the cisternal or internal auditory canal is always abnormal. So let's take a drawing here. Cisternal or segment within the IAC is abnormal, while normal enhancement can be seen in these segments.